welcome to Expect More with Dr. Andrea. I am the host, Andrea Davis, physical therapist, and I am so happy and proud to have my friend, who I've never met in person, Dr. Courtney Green from the PTP lab in Alabama. Courtney, welcome. Welcome.
Oh, thank you for having me. Yeah.
Oh my God, are you kidding? It's going to be trouble having you, and I'm excited. I'm here for it. I'm here for it. Very like-minded individuals that have never met in person. Physical therapists on different but similar journeys and trying to build a sports medicine practice that we can be proud of. So please introduce yourself and tell us all your life history.
Well, I'll cut a lot of that out, but I am Courtney Green. I'm the owner and doctor of physical therapy at PTP Lab. That stands for Physiotherapy Performance Lab. It's in Coleman, Alabama. If nobody's ever heard of Coleman, Alabama, it's between Birmingham and Huntsville. So we are right in the heart of the north part of Alabama. And yes, Andrea, we haven't met, I guess, in person, but we've done a lot of Zoom meetings, called on the phone. And I started this journey about 8 years ago. Started out in another private practice of my own, partnered with somebody with strength training, and then went out completely on my own almost exactly a year ago. March 15th last year, I opened this facility, and we got deemed by the state as the only research and development facility like this facility in the whole state.
Awesome.
So
it's awesome. Love it. Badass chicks doing badass things. It's amazing. And you are qualified as that for sure. Especially in this sports medicine world, right? Like, let's be real. It's not, I mean, I'm 40 years old at this point and, older than you, but been around.
We're both in that 40-year-old range.
40 range.
Yeah.
25 years in PT. So I've been 25 years in PT and, been an athlete since I was probably born, but we'll say formally maybe 7 years old. Coached, college, athletic training, all the things. And it's not easy. You would think in this day and age, it'd be way easier for us to break into sports medicine, but
no,
right?
It's pretty tough. I think there's a stigma still that I guess men kind of handle the sports aspect, from the training, from the athletic training standpoint, physician wise, PT wise, everything encompassing sports medicine in general typically is male dominating. And like-minded females have come along and, we have kind of broken that barrier and taken over and shown kind of where our stance is. There's a lot of stuff that's coming out in research and everything with female athletes, training difference and body type difference, things like that, that doesn't associate them with exactly what the male athlete is like. But yeah, it's tough being in the clinic and they walk in and they've been recommended with, hey, come here. This is the PT place that you need to come for sports. And say you have a male baseball pitcher and he walks in, he sees a female and he's like, what the crap? What do you know about my baseball pitching mechanics and how to tell me how to do stuff? Yeah, breaking down that barrier, I think we have like that trust issue that we have to earn that maybe a male PT doesn't. So I think we have to work extra hard to earn that 1% trust factor on that first visit.
Yeah, I mean, I would agree with that. And even in, it's one of the reasons I went on to coach at a Division I level, to be honest, was to, for lack of better terminology, get that street cred of
Right.
like, oh, you did that? You recruited?
Yeah.
So I worked full time. I mean, not to be like whatever, but I worked full time as a PT, and then I went and volunteered in Division I and coached at Division I level and recruited all across the country, which at this stage allows me, I think, to just step into those situations like you're talking about. And I think when you can bridge that gap with the knowledge that there's definitely, like, I watch it happen even with parents. So like when I'll say, oh yeah, I played for 4 years. I was 2-year captain of my college team. And then I coached college for 5. They're like, really? Yeah. And then I'm like, sweet, I'm in. Let's go.
Yes.
Yeah.
I mean, your credit just boomed right there. I mean, it's almost like you build it, they'll come kind of thing. If you have a small facility, they don't think you know anything. You build a nice facility, you still don't know anything, but they do. They think you know everything. So same thing with that.
Yeah, and I'm sure like one of the reasons we've always gotten along so well, like you said, I mean, we were introduced I think through Trent, right? Trent
Yep. Yep.
Nestler, who like recorded with me a couple weeks ago or a couple days ago. Can't tell the
Yes.
difference right now, but uh but he was the one that I appreciated so much, being like, "Oh, you two need
Yeah.
to like,
Yeah.
talk. Like you talk the same, think the same." And I think a couple of those threads are use of technology to advance our knowledge and provide more data. So can you tell me
Right.
what your journey was with that data application and what that looks like?
Well, over my outpatient career, I've always used as much technology as possible, but there again, it was kind of vague and very little that our profession had to offer. Trent was on the verge of the AMI, the Athletic Movement Index, which is on one of your podcasts. And you can look it up, and a lot of research has been dealing with technology and how much focus we need to have as PTs. There's only so much we can kind of data driven with our own eyes. You can be super skillful, but there's only so much you can do. So with the implementation of the AMI that I had in my clinic, it just skyrocketed on what I was able to offer. Not only just the skill set of mine of assessing through my eyes and, palpation, that sort of thing, but just having that added data. So when I implemented that several years ago, I never looked back. I didn't really use any other technology as far as assessment goes. I did use the QuickBoard. That was also something else that we can have in common. So that was another way that we just kind of bridged our gap from way up north to down south, staying on the East Coast side. But it's interesting with how many people want to keep doing the same stuff over and over, and they don't want to branch out and see what's out there. And so when Trent introduced me with the AMI, and man, I was hooked from the get go. And then he said, "Hey, there's another lady up north that's utilizing it." And being able to talk with somebody freely that utilizes the same kind of technology, and the emphasis, the priority that we have on that technology for our athletes, they can't get it anywhere else. And so we're kind of pushing that barrier of, hey, how many athletes can we touch? How many occupational athletes can we touch, military, stuff like that we can get this data to and help them either post injury or even prevention of injury.
Yeah, I mean, it's definitely bridged the gap. And the thing that was most rewarding to me was like, it was like an easy flow of conversation. Cause sometimes like female on female conversations when you don't know each other and there's like, maybe I'm a little competitive. I know you're a little competitive,
Oh, I
but
am. Maybe just
I
a
know,
tad.
I know. So competition from afar is fun in the sense that like
Yes.
we can push each other a little bit
Yeah.
without, worrying
Should we
about
go based on who has assessed more or something in the amount of time?
That's so hurtful. That's so hurtful. Now, the only reason, Courtney, I'm going to be clear, it's just for anybody that's paying attention. The only reason Courtney wants to say, should we go on who's assessed more athletes is because girlfriend has locked down multiple clubs and does a ridiculous amount of AMI sensor data testing.
Yes.
To the point where it was like days long, I believe, if I'm not mistaken, right?
Maybe. Yeah, just a
Yeah.
tad.
Yeah.
But I have you driving right behind me, so I gotta get something.
Yeah, I don't know. I think I have like, more PTs, so we
Yeah, see, that's not fair.
I know. So 1-to-1, you definitely got me beat, but like
Okay.
organization
We're
to
just gonna leave it
organization,
at that.
yeah. Just putting it out there. No, I'm just kidding. But like I mean, have you seen a difference in the tech, like with, male versus female or from sport to sport? Like, have you seen it be like, has it changed how you operate since you started implementing it?
So it's kind of funny because, we're both collegiate athletes. We both have been around sports all our life. And so coming in with the knowledge that some PTs don't have that, end up falling into the realm of, oh, I'm going to treat athletes, it doesn't matter, but they don't really, really know technique, mechanics, things like that. And they're too afraid, I guess, of kind of going against
Yeah, rocking the boat, right?
protocol.
Yeah,
Yeah.
yeah. Mm-hmm.
Um,
I love
and
rocking the
going where
boat.
they're, oh, I do too. Ask for forgiveness, permission, you don't need that. Um, but having this data that's really objective, I guess the best thing and the most impressive data that I can get to the athlete and their parents, even a coach that comes in, is because I really want them standing behind me when I do a test. And I don't know anything about the athlete. I always make sure I say, hey, I haven't seen you play. I haven't seen any videos of you, nothing. And so I'm going in blind and I can say whatever I want to, like I used to, and gain that trust. I've already gotten a little bit of trust. We go through the test and then I turn around and within seconds, I'm able to diagram something that they do wrong as far
Mm-hmm.
as when it's on the field or on the court or on the mound or anything else. And they just look at me and they're like, how in the world did you know that? And I'm like, well, your
I'm
skills
pretty
coach,
smart.
yeah, your skills coach usually says this happens, even in golf. Okay. If you're not going to thin the ball, you're going to hit it fat. That's going to be your tendency. It's because you're sliding your hips instead of rotating. It's little bitty things that they're like, how in the world did you even know that? And it's because they now see not only do we know the sport, but we know the athlete, but now we can take objective real-time data immediately and interpret it enough to tell them something that clicks of, I need this. And I definitely trust this person that's sitting in front of me, whether it's a female or male. So that's really gotten me past the barrier faster. And so I feel like I'm not wasting as much time my first visit. And I'm really quick to do the AMI. Do it early on in the rehab
Yeah,
process, earlier than most
sure.
PTs, I would say. And I'm constantly reassessing my patients or my athletes, no matter if they're a patient, if they've been a patient, or if they're just coming in for performance training. So that sort of thing kind of gets them on the timeline of, hey, this person knows what they're doing. They really care about me. It's not cookie cutter. Things are changing in my data and it's emailed right then. And that's what I typically say. Hey, we're going to do this test. I'm going to go ahead and email it to you. I'll run through the data really quick, just kind of scratch the surface. I'll give them one little kind of
Like a
little
nugget
carrot,
takeaway. Yeah,
yeah,
yeah.
to kind of dangle in front of them to go, okay, this is really legit. And then when they come back, I'm like, hey, this is what you're getting. Maybe 2 hours of analyzation that I do on my own after it's emailed to you. So I can't change anything on the data. And then when we reassess and we retest, it's automatic. Not only are they seeing it, but now they're actually seeing data and they're seeing how much has changed. That really gets them. So yeah, the stuff that we know, testing wise, the stuff that we see on the field, on the court, that's different, male versus female, sport, position, all that
Sure.
is
Yeah.
now being captured in a data driven technology basis. And so we're able to gather stuff to do research on. And it gives us a whole lot more credibility on the PT side instead of people looking at us as, hey, we only go to them after surgery or after an injury. Now they're looking at us, and I've always said this, is we want to be the quarterback of the football. If you
Yeah.
take football, you want to receive the football first. And so that football is the patient. We want to look at the field and we want to see how to direct them. Do we keep the ball? Do we take a run for it? Or are they needing to navigate the healthcare system and fast track them to other places? This is exactly how the pros get, and that's how we want to do. So there's nothing that prevents somebody from getting that same type of treatment. It's just the mindset needs to change.
And I agree with you. And it's a heavy lift sometimes, right? Like we were just, Antoinette and I were just discussing this yesterday. We were in a meeting or something, but the education piece that like, once you know, right? So once you're injured and you come to see us and we do the tech and we talk the talk and we walk the walk and all the things, it's like, oh my God, how is not everybody know this?
Yes. And I
I
get that a
still,
lot.
right? No,
Yes. And I'm
same,
like,
same.
God, I've been here forever. But I mean, I think we got to look at it as a profession. And, you and I talk about this all the time. I'm in the wonderful state of Alabama, so you can edit that out if you need to. But Alabama, each state is different. And so our profession, I think, as a whole, does a very poor job, not only state to state, but as a nation. I mean, we've sat here and fought so hard to get our doctorate level of knowledge, but nothing else has changed. Everybody's treating still as though, hey, I'm going to take the order from the physician. I'm going to see exactly what they said to do. And whether I agree with it or not, it's like on the job training. Well, that's not what I went to school for. So I think as a profession, having people like yourself, me, Trent, people like that are willing to push the boundaries for those that are up and coming, I think it's going to take a little bit of pressure off of the community to try to figure it out themselves if we sit here and push more and more.
Yeah, and be more vocal about it. And that's right, part of the things like, the education piece. Really, it's not about educating physical therapy. Most people have had experience in physical therapy. Right. If they've heard good or bad, it doesn't matter. They've had an experience. But it's always, at least in my experience, the majority of the time, it's a reactive experience. Something bad happened. And then I went to PT. What I've been doing my entire career, which I didn't realize was so, crazy, maybe, which I don't think it is still to this day. But, we go to so much schooling on biomechanics and we have so much training in musculoskeletal. We are experts in biomechanics and musculoskeletal, which means we are movement experts. So if we see something, and this is like, you go like 7th and 8th grade, you go into the girls' gym and you have a whole entire female team. Hey guys, show me how you jump. And you're like, oh God, stop. Please stop. Please stop. Because we know there's valgus collapse. Right, exactly. So valgus collapse, for anybody paying attention, really is when the knees collapse in underneath the hips, and it's one of the biggest predictors for ACL injuries and or repetitive stress injuries in women specifically. And
I think one example of that,
and that's where the data comes in, right? Yes, so like we see it, but now they see it and they're like, "What? I don't have any pain." You're like, "No, but you got 35 degrees of valgus." Right. Not great.
Well, and I take this. I had an ACL patient that is here probably 4 months out. She's not getting PT anymore. She's way past that. She's actually strength training with me. I did the test at 11 weeks. I did it a little bit later than I normally like to, but I did it around 10, 11 weeks. And I showed her dad. She has a twin sister. They both play collegiate basketball. Yeah. They're unreal. There's no reason on paper she should have had an ACL injury, non-contact in basketball practice. And it was before the season started on the last scrimmage game. So on paper, they're pretty much identical for the girls. And her sister did not have anything happen, and she did. That was the frustrating part when they came to me is, why did this happen? And we go through the rehab process. It's very accelerated. It's aggressive. We do all the things that we normally do. Same thing, how you treat. And then we go into the strength side. Because now the question is, I don't want it to happen again. Yeah. And then we do the test and they're like, dadgum, no wonder why it happened. Look at my other leg. I'm lucky that it didn't happen earlier. Yes. Right? So now it's like, crap, I wish I would have known about this sooner. That's how much I get. It's drilled into my head every day. I hear it at least once. I wish I had known about you sooner. So it's just the suppression that we have, I guess, as the profession of we're limited, but then again, we shouldn't be.
I don't think we're limited. I think we limit ourselves, right? Like as a profession, and I call, and I'm probably going to take some slack for it, but that's why I'm independent. Whatever. Surface PT has no place for me anywhere. Nope. And that's like a phrase I've used for myself, and I've slowly started being a little bit more vocal about it. But come in, do straight leg raises, give me some ankle pumps, and okay, your pain's gone. Peace out. It's never been my bag. It'll never be my bag. And like to find like-minded warriors like yourself, because that's really what happens. Because people are like, why do you care so much? Why do you not care so much? Like why wouldn't you care if there's a system or data that literally is going to flag for you? Hey, guess what? You have a 90% chance that thing's going to go at some point.
Right.
Why would you not try and get a checkup? We started doing like annual checkups or checkups every 6 months or whatever. And it's been going quite well. But the part that makes me sad still is it's still a hard sell.
Yeah.
If you haven't known or experienced someone that's had a catastrophic injury.
That, or just the pure fact that they see it in person. So when
it's true,
I'll welcome family members to come in. I treat one-on-one. It's not a group session.
Mm-hmm.
And when they come in, I mean, no, I don't want them hugging over their loved one, but as far as them being in the vicinity, I want them to kind of be close enough every now and then to be able to see how different it is. Because I always get told, this isn't how it's usually, being, or, hey, I had a friend that had the same kind of issue and they're not near where I am. So things like that, it's comforting to know that you are doing the right thing and people see that you do care. It's not just, hey, I clock in, clock out. I'm doing exactly what somebody told me to do. I want to use my brain when I come to work. And it is harder. It's harder to treat that way. And I get it. And that may be some of the issue of some PTs in a corporate setting of, my hands are tied. Why do I even care? Buck the system. It's too risky. And this is just comforting to kind of know that I can go to work every day, leave and go home, and it doesn't matter. And I can treat as many patients at a time as I want to. And it's just here, do 10, 10, 10, 10. It's not a big deal. I don't have to think. I am exhausted by the time I go home every day.
Yeah, girl.
Mentally, physically. I mean, yes, I have paperwork, but I'm constantly paying attention to my patient, and I have no clue what I'm going to do with my patient when they come in. It's based on what they say. How did the last session go? I'm always progressing. They have no clue what they're going to do when they come in. And so that's what they're paying me for. And I think overall you get more loyal patients, clients, whatever you want to call them, because then they start going, she's different. This place is different. I get better faster. That's the hard sell. It's money out of your pocket in the beginning, but you get more and more people because you actually do care about getting them back to doing what they want to do quicker and better.
And you're serving as a resource, really. That's the other upside, right? So we get exposed to a lot. And it's one of the reasons I started doing this podcast too, is because my business has gotten bigger and the practice is, doing okay. But I've lost my ability to connect with people. Like I still go like on the floor and I like go and I talk to PTs and I talk to patients. That was like the light of my day, is being around people, and athletes, and having them come back in and be like, oh my God, I got to blah, blah, blah. And I scored 2 goals. And I'm like, yes, like exciting. Yeah. But like, I'm so frustrated by still to this day hearing things like, PT didn't work, or, PT stupid, blah, blah, all the things. It's not, if you're in the right hands and you're doing things like you're doing, and like there are some of us more than I realize out there trying to push the limits and do a better job and deliver a better product. And I'm like,
and it's tough too, because there's not a lot of open communication when you're in a closed vicinity. So like, it's a very competitive field. It's just like a pop-up shop wherever they want to on the corner of the street. But somebody like you and me, distance, me and Trent, that distance, it's comforting to know you have somebody bounce ideas off. You don't feel, I wouldn't if they were down the street, but as far as competition wise, they're not trying to steal your patients, but you're able to help the profession. And I think there's more and more of us trying to connect over the US that I think eventually it's going to happen. It's just not happening faster or fast enough for us, I guess.
Yeah, and I like to think of it in a, you talk about competition. I like to say publicly and to myself that I'm just competing with myself and what I feel is the best version of what our profession can provide. Now, I am not an academic. Now, we participated, like we were doing research things together, you and I participated in research, and, you know, there's some big names that we were floating around with and dealing with. I found myself on a few calls that I was like, what am I doing here with all these
like
intelligent?
Me with you?
Ah, you're so silly. That's so ridiculous. No, but like there is something to be said about trying to push and raise the bar, because these young guys coming out, these new grad guys, man, they're getting either smacked in the face with productivity, or they're getting smacked in the face with the two sides, talking out of two sides of their mouth, I guess. Like not the new grads, but what they're being told, like, hey, we care about you, but only if you hit like 97 visits a week type thing. Right. And I still think, listen, I may never make like buku ridiculous money, and I'm like totally fine with that, because I feel, at least in my corner of the world, as I know you feel in your corner of the world, I'm trying to make this better and open people's eyes that they should expect to deserve like a little bit better level of care. Like you and I both saw it in college. I didn't have the benefit of it in college, unfortunately. No. When small school, girls sport, we always got the crappy hours, 5 a.m. or 10 p.m. practice times, like terrible. It seems like that's shifting a little bit, but I don't know that everybody's catching up with the idea that there are different things that you can aspire to do within our career that have yet to be done, except by people like me and you.
Oh, that's right.
So how hard is it?
Die trying.
Oh God, so hard. Gonna die trying. So on that topic, right? You and I cannot be on a call where we don't talk about being a mom and a wife and a business owner and in sports medicine, and how do we do all the things we do? How do you do it? You do not. Shut up. You got a great family.
Horrible work-life balance.
No.
All I can say is, thank God I married somebody like my husband, and I'm sure your husband is the same way.
Yes.
Because
Saint Rich.
Yes, like I literally, I don't know why, but from the get-go, when I started outpatient, all of my patients have my cell phone number. And it's not a work number, it's my cell phone, my personal one.
I know, me too.
I want them to feel like if they contact me, they are getting me. They're not getting a front office. They're not getting an answer machine, because there's times that things happen and you're not going to be able to get in touch with a physician, but at least you can get in touch with someone.
Yeah.
Either to calm your nerves, until the, next day, until the physician's office opens, whatever. But that relationship of saying, okay, they're even giving me their private cell phone number. That's pretty important. And our athletes, they're always traveling, things like that. So there's always questions. And so I would rather them ask me, and it actually makes my job a little bit easier because they can quickly get a hold of me. But I think having someone that's not in the medical field, my husband is non-medical, thank God.
Yeah.
And he's very understanding, because he knows that as much as I love being a wife and a mom, I have 3 kids, I also love helping people. And that's what I was called to do. And that's what I do all day, every day. And so having someone try to help with that work-life balance is important. So definitely having someone that cares so much about his clients as well, because he's in the finance world. And he has some uphill battles in that as well, because a lot of times that's not where people really care about. And so we balance each other out, and he knows when a client is on my mind and I can't get something figured out for a patient, and I'm up, or I wake up in the middle of the night and I grab my phone and I start typing something out because something hit me. He's like, "Yep, you have a patient, don't you?" Yes, I do.
Yeah.
But things like that, I think it is tough. I think early on, I struggled with it more, I think, when my kids were a lot younger.
Yeah.
But I think as
Me too.
Yeah, and I think as they get older and they see the importance, because each of them has had PT before, Granted, they're not going anywhere else. They're only going to
Of
see
course.
here.
Of course. Of course.
Nobody else is good enough unless you're going to go to
That's right.
Tennessee or New Jersey. uh,
Yes.
but I say that because they actually are old enough to understand what I do. And they've been around, I guess, in the clinic to understand, oh, she treated somebody I know. And they're like super pumped. Or, oh, hey, my mom helped my friend out. Or, hey, my mom helped my friend's mom or dad out. So it's connecting the dots now that they're seeing, wow, it's super important what my mom's doing. And then when she comes home, I have to be diligent enough to really be honest with my kids and say, yes, my cell phone is attached to my work and I'll have it with me. It's going to be on me, but I'm going to continue to try to be better about focusing on them and my husband when I'm home. But if something were to, ding
Yeah,
and I
come up or
glance at it,
whatever.
yeah,
Yeah.
if I glance at it, it doesn't mean I'm going to have to answer right then. I just may make sure it's not an emergency and then I'm going to put it back in my pocket. But being more open with them and honest instead of trying to hide my cell phone and figure out, hey, man, I've gotten 10 messages. I hope it's not, and I'm really not focused on them.
Yeah.
Getting it out of the way and taking care of it and then going back to them was super important. And so I think my husband really helped with that. I'm still trying to learn every day to be better and better. But it's tough being a career mom and having that work-life balance. But I think eventually, you try to kind of settle down in a mode, I guess you could say, and your spouse is super important for you.
Yeah, no, I mean, a similar journey for sure. And I actually started the practice, as you know, when my husband was out on strike. And when I came home one day, he was standing in the kitchen, bewildered, like literally bewildered. And he was like, I, how do you do all this? Like, how do you do all this with the kids? And I
We
just
don't
chuckled.
sleep.
Yeah. But I'm actually, it was a very difficult time in our life and our journey or whatever. But for me, that was his wake up call that he was like, wow, there really is this,
Right.
unspoken. And I don't want to say double standard because he does way more at home than I do.
Right.
Now, currently, I'm like living a pretty
Right.
sweet life when I go home because, well, my kids are 14 and 17.
Right. It's a little bit different.
It is, but you know what? It was a big fight to get to the place
Yeah.
with my kids that they
Right.
understood, like you're saying, like the meaning of the work. Like I know this is my purpose. Like my purpose
Yes.
in life is to try and, better the profession, take care of my community. And like my elevated purpose is to make it better for the next generation so they don't have to
Absolutely.
go through all the struggles that I went through, female sports medicine, but just private practice, period.
Absolutely.
So, and to know that you can do it. So for me,
Right.
it's like, I'm on the other side, so to speak. We've been in business,
Right.
it'll be 9 years in May. And, my son now, who is 17, he's interning with us starting in June as like a content creator. And he went with me. Last year we did a trip to Oklahoma or whatever. Yeah, I was telling you, went on a TV show, competed, all the things. My boy was like a stud. He like his
awesome.
mind at 17 on business. And he was so sweet because he gave me some credit. And that right there, publicly, he said, oh, well, my mom, she works really hard and she does all this
Right.
and she still makes sure we're okay. And I was like,
Right.
all of it in that moment was
worth it.
totally worth it and validating.
Too, like I have 3 kids. My middle child is my daughter, and she's the one that wants to be in the medical field. She actually wants to be a surgeon, a pediatric cardiothoracic surgeon, or pediatric
why not?
neurosurgeon.
My daughter,
all the way.
Neurosurgeon, actually.
Yes,
my daughter.
yes.
That's insane.
So one of the two, and it's nice to know now because she continues to look at me and see that I'm still a mom. I'm still a wife. I can work crazy
It's possible.
hours. And it's possible because I had a stay-at-home mom. And back then, there was a lot of one-income families. And so I didn't have a standard to hold except here's the standard of a stay-at-home mom. And I'm way off of it because I have an outside job. And so being able to figure out that balance and now try to show her that it can be done, because used to it was, hey, you want to be a surgeon, good luck with a family. screw that. That's not going to happen. But it can be done because there's so many professions that have crazy hours like us that not only if you're a surgeon or not, you can still be married, you can still have a family.
Exactly. And you really don't have to choose, which is something
No.
I struggled with on the other side, just, thinking that I had to be all this way or all this way. And now, like, I'm in a really great spot. And like you said, it definitely helps. Like, not everybody is married to Saint Rich like myself.
No.
But it also lends to, if these are things you want to do, that your partner should be allowing you to have the room for that as well. And it definitely, we've had our battles for sure. And I like work, so I work too much and all the things. But when it comes right back down to it, our story of our life, owning a business, living in the town in which I own the business, which, is, and my kids go to school in that town.
That can be good and bad.
Yeah. Take your pick.
I have to do this a lot.
Yeah. Take your pick on any given day. I enjoy it now because I understand it, but it's gotten easier because, we have open conversations now with our kids about it, and they get it. And we have family meetings on Sundays where we plan out our week. Hey, mom's off the grid, from this day and this day. And I'm actually really enjoying it. So it is possible. Now, can you have it all? No idea. Because tomorrow, Courtney, we'll talk and I'll be like, I suck. I'm terrible. I'm a terrible mother. I don't know what I'm doing in business.
I alternate those phone calls a lot. Like,
Yeah.
I just hope we don't ever end up on the same bad days, because then I don't know who we're going to call.
Nope. That's all right. We'll just pull each other out. But yeah, no. I'm so grateful that you agreed to come on, and thanks so much for like honest conversations and straight talk. So tell everybody, if they want to learn more about your practice and what you do, where can they get a hold of you? Not your cell phone number, maybe, but
well, that's on the website too.
Oh yeah, all right. Well, how about it? No, out there.
No, it's PTP Lab. You can look on the web page of myptplab.com. We're on Facebook, LinkedIn, what's the other? Instagram. We're on all those things. And I don't do as good of a job as posting as Andrea, but one day I'll get there. Oh my
God, stop it.
So I'm going to have to start like setting a schedule. But all those things. And then of course my cell phone number is 256-708-0329. And I just enjoy talking with other PTs and the upcoming PTs, because I definitely want them to enjoy and reap the benefits that maybe myself, you, people like us that have pushed those barriers and allowed them to gain some access to other things.
Yeah, we're aspiring to that national tour we talked about a couple of years ago. We're going to have our speaking tour one of these days. Yeah.
Women own.
Girl
Sorry,
power. Yeah, no. Trent will have to sit on the sidelines for that one. That's all right.
Yes.
The Athlete Lab can sponsor that tour.
Kid. I mean.
Yeah. Oh my God, it's awesome. All right. Well, Courtney Green, thank you. And until next time, guys, peace out.